สวัสดีค่ะ Today I would like to give you the information about the twin-to-twin transfusion syndrome or TTTS along with the treatment options. Twin-to-twin transfusion syndrome or TTTS is only occurred in the monozygotic twins, which is a pair of twins that came from the conception of one ovum and one sperm. The monozygotic twins would have 2 amniotic sacs and just only 1 placenta. TTTS is caused by the abnormal blood circulation from one twin to the other. The blood would circulate from the donor to the recipient. The donor can possibly have the following problems: decreased amount of amniotic fluid, anemia, hypotension, growth restriction, placental insufficiency, and also fetal demise. The recipient would be receiving too much blood volume, causing increased amount of amniotic fluid, polycythemia, fetal hydrops, and may cause a cardiac failure and fetal death. Without the treatment, what could have happened? The unbalanced circulation could affect the fetal brain and the nervous system, especially on the donor. If there is the death of one of the fetuses, the blood would immediately shift from the surviving twin to the other, causing a hypotension of the surviving twin, and may cause a condition called brain ischemia and sudden death. Also, with the increased amount of amniotic fluid of the recipient, this increases the risk of preterm premature rupture of membrane, miscarriage, and preterm delivery, which will in turn increasing the risk of fetal death for one or both fetuses. The prenatal death of the donor could be as high as 80 to 100%. Treatment options for TTTS are amnioreduction, a reduction of amniotic fluid, fetoscopic laser coagulation to destroy the vessels running from the donor to the recipient, bipolar cord occlusion, radiofrequency ablation or RFA. Treatment with fetoscopic laser coagulation. Fetoscopic laser coagulation is to use the equipment as small as 2.7 millimeters to 3.8 millimeters inserted through the maternal abdomen and the uterus into the amniotic sac of the recipient, and then using the laser beam to coagulate the vessels connecting the donor and the recipient. The advantages of fetoscopic coagulation. Treatment at the root cause of TTTS. If all the connecting vessels are coagulated, the fetuses would have their own blood circulation. In case of a demise of one fetus, the other would have no direct effect. Releasing some of the amniotic fluid during the operation would reduce the risk of membrane rupture, miscarriage, and preterm delivery. The possible complications: membrane rupture, miscarriage, fetal death, either one or both fetuses. But this only occurred in 20 to 30% of all the cases. The cost of the operation: approximately 80,000 to 100,000 baht, and you might need to stay at the hospital for at least 3 to 5 days after the operation. I hope this information giving out today will be beneficial to you. Thank you very much for your attention.